thanks a lot the organizers for giving me a chance to speak here. Let me share my screen. So distinguished dignitaries, today the topic of my presentation is impact of COVID-19 pandemic on the young generation, lifestyle and social aspects. So as we all know that this age group, the young people, which WHO says between age group of 10 to 24 years are young people, and between 10 to 9 years they are known as adolescents, because this is a transitional phase from childhood to adulthood. There are the physical, mental and emotional changes. That's why this is a vulnerable group which we should address about their problems. And moreover, during the COVID-19 pandemic, the lifestyle of the young group was disrupted all of a sudden. There was isolation, social distancing, all those things. So an understanding of these changes and timely intervention can promote healthy development into early childhood. That's why this group was taken, and we did a study on this group. And in our country, in India, not only in India, all over the world, all of you must be knowing that there was this social distancing, restriction of gathering. All of a sudden, the educational institutions were closed and students were sent back home. So there was self-isolation, and the teaching shifted from classroom teaching to online teaching format. For that reason, this age group suffered a lot. So there was a lot of impact of the social distancing on this particular age group, the young people, the young generation. And all this led to lots of vulnerability, where they had a negative coping behavior, negative lifestyle changes. And moreover, they were not able to vent out their feelings because they were distanced from their peer group. All this led to depression, anxiety, and stress. Now, the group that was the student group, usually that was under pressure of performance, because when they were in the premises, in the college premises or the hostels, then they had a peer support, which was there when they were doing the online studying, online classes. So that was the problem. And moreover, the young adults who had the fear of not getting a job, losing a job, and there was performance pressure. So all these factors led to a loss of self-esteem. The students also had to meet the academic requirements. There was a heavy curriculum, high performance pressure. There was a fear of failing because of lack of communication between teacher and student. And that's why there were mental symptoms. So during this time, there was a need for help, need to reach out to this particular group, either through online interviews, counseling sessions. There was a need that the teachers or the parents even should lend a helping hand to this group. And we at KIIT University, which is one of the top deemed universities in India, we have a very robust mentor-mentee system, where one mentor will meet 8 mentees weekly, and then they will talk to each other, vent out their feelings. They will not only discuss the academic aspects, but also personal aspects also. If there is any personal problem the mentee is having, then the mentor tries to solve those problems as well. So this is a method designed by our functionaries to alleviate the mental health problems of the adolescents and the young adults. So as they say that helping hands are better than praying lips. That is why a study was taken up in my university, where the mental health status and the coping strategies were looked into during this pandemic, COVID-19 pandemic, among the undergraduate students. Herein, for this study, we took the healthcare profession, students from the healthcare profession, where we found that there was a prevalence of this symptoms of depression, anxiety, and stress in about say 26 to 27% of the students. But when we compare this to the other studies, it was far less than the other studies. Now, what we found is that the students, when we divided into different age groups, students who were more than 20 years, they had, there was a statistically significant difference of the prevalence of depression, anxiety, and stress among them. Then when we studied by dividing into different body mass index groups, we found that the overweight had a statistically significant difference from the other BMI groups. And then when we looked into the soft drink consumption, frequency of soft drink consumption, the group which was consuming more than once a week, there was a the statistically significant difference was there of the depression, anxiety, and stress. And one more thing, that when there was comorbidity was existing, then also the symptoms were higher. Here we saw these are the comorbidities in this group, like the students, though in the young age group, also they were suffering from hypertension, diabetes, asthma, arthritis, etc. Now, one more thing, that when we looked into the screen time habit, other than the studies, of course, more than 12 hours per day, there the prevalence of anxiety was more than those who are having less screen time, used to less screen time. Now, coming to the coping strategies among this age group, then we found that usually they had a negative coping. Here we can see that of the students who had negative coping, usually mostly it was denial. So we can say that we found that mostly the students, out of them, they were in denial that they had a negative coping style. And then this was found statistically significant difference was there in this group. They were overeating and denial. So negative coping behavior. And the coping behavior, self-blame, was also found. It was significantly associated with depressive symptoms among both males and females. Now, avoidance coping strategies like self-distraction, behavioral disengagement, and denial showed significant association with depression, anxiety, and stress symptoms, both in males and females. So then these findings definitely do say that there is a need for intervention, a need for counseling, and need for interacting with them frequently, and there's a need for designing robust intervention strategies to alleviate these symptoms among the young population, as they are the future of any nation. So right now we are planning for an intervention strategy like giving yoga therapy to the young adults and the adolescents, which will help them cope better in a positive way. That's all about my presentation. Thanks a lot.